Hello, my name is Dr. Keith Coffman, and I am Director of the Tourette Syndrome Center of Excellence at Children's Mercy Hospital and co-chair of the Medical Advisory Board of the Tourette Association of America. I have more than 10 years' experience in the care of patients with Tourette syndrome. What I love about being a physician for patients with Tourette syndrome is the ability to provide comprehensive care of not only their tics, but the other comorbidities that affect their quality of life. Our topic for today is planning for a successful doctor's visit. My first suggestion is choose the right medical professional. There are a number of medical professionals who care for patients with Tourette syndrome. There are child neurologists who are expert in the neurology behind Tourette syndrome. There are developmental behavioral pediatricians who are expert in behavioral management and medication management. And there are child and adolescent psychiatrists who focus more on the psychiatric comorbidities that occur with Tourette syndrome. If you're unsure of where to start to seek help for the care of your family member with Tourette syndrome, the best place would be to speak to your primary care physician, whether it be a pediatrician or a family practitioner, to get guidance on whom you should see next. My second suggestion is to be prepared for your doctor's visit. What I mean by this is when you come to see a medical professional for Tourette syndrome care, feel free to bring a list of the most important and pressing questions that you have about your child. It is only through being able to review the list of questions that you have as a parent that the physician will be able to address all of the needs you have to provide the best care possible. My third suggestion is to know your child's care team. This includes not only the physicians that your child sees for the care of their Tourette syndrome, but also the other providers such as a child psychologist or therapist, as well as the educational team. The reason this is important is that oftentimes child has difficulties in school that directly relate to their Tourette syndrome or associated features, and only by allowing those professionals to speak and interact with each other can everyone be on the same page and the outcome be the best. My fourth suggestion is do not be afraid to share. Whether this be an issue of a tic that your child finds so embarrassing he or she doesn't want to discuss it, a compulsion that you as a parent find very disturbing, or something that is troublesome, such as intermittent explosive behavior, also referred to as Tourette syndrome rage. These features, while bothersome, are critically important to discuss with your medical provider so that he or she can help treat them effectively and improve your child's quality of life. My final suggestion is know when it's time to seek a second opinion or find a different provider. Oftentimes in treating Tourette syndrome and the associated features of it, it requires a multitude of physicians, and sometimes the first physician you see doesn't have the insight or expertise necessary to provide the most appropriate care. If you find that every time you see your child's physician, he or she is recommending adding yet another medication, or you find that they ignore your most significant concerns or your child's most significant concerns, it's time to look for a different physician, perhaps with alternate expertise. In conclusion, when seeking care for your child with Tourette syndrome, please understand that what a physician doesn't know, they cannot help you or your child with. So feel free to talk about anything and everything regarding your child. To begin your search for a provider for your child with Tourette syndrome, please go to tourette.org.